Hello, I'm Tom Stapleton, Executive Director of the Wakefield Community Access Television Station. And today we have Senator Jason Lewis with us again. He's going to bring us up to date on everything that happened since the last time we met. And it's a lot. It's a lot. How are you? Good to see you again,
It's great
Jason.
to be back with you.
Very good. So we're going to start right out with it. Now, the Senate recently passed a $40.8 billion FY18 budget. Can you break down the highlights of that whole thing there? I mean, in less than half an hour.
Sure. Well, and actually, we're recording this show on the last day of June, and in fact, the House and the Senate, the House of Representatives and the State Senate, are negotiating right now on the final details of the budget, because the House and Senate each passed their own version, so that we have to just reconcile some differences. But the new fiscal year starts July 1st. Fiscal year 18.
That's
so
right.
it is. Yeah. We're working with urgency to get that all done, because the new year is here, and we want to make sure we have the new budget in place. And so the highlights are, it's a balanced budget. We have to run a balanced budget every year. We're required to under state law. It does have an increase in funding for our schools, for public schools, and also for local aid, which is the money that our cities and towns receive for things like public safety and for senior services, libraries, things like that. There's also some increased funding for things like mental health treatment, substance abuse prevention and treatment, some of the other critical priorities that we have. One thing in particular that I'm pleased about is there is I was able to include in the Senate budget, and Representative Paul Broder and Donald Wong were able to include in the House budget, is some money specifically for the Wakefield Main Streets program. Which is a terrific local effort. It's a local nonprofit that is working to help revitalize downtown Wakefield, to improve the aesthetics, to attract more businesses and retailers, and just generally increase foot traffic and shopping and dining. And so this additional, it's $100,000 if we're successful in keeping it in the final budget. That would help to really accelerate those efforts.
Oh, and they've been looking to try and get that town squared away, Wakefield, and it has started. There are some people who have refurbished the front of their stores and so on. So it's a nice, it's working, and this would be a great plus. That's
what we hope. There's great things happening downtown, and a good effort on the part of the Board of Selectmen and the Wakefield Main Streets and the Chamber of Commerce, and a lot of people are collaborating, and so we just want to try to help further those efforts.
Right. Very good. All right. Well, you're once again serving as chair on the Committee for Public Health. And what has been a focus? What has been your focus, and how does it help our constituents?
Sure. So I sort of wear two different hats as the state senator. My first and primary hat, of course, is to represent the communities that I serve and the constituents. And then the other hat that I wear is as a chair of actually two committees. I know we'll talk about another one after this, but the Public Health Committee is one that I've chaired for several years now, and really the goal is to try to strengthen and improve public health in Massachusetts, and specifically to look at ways to bring down rates of chronic diseases that are preventable in order to try to rein in healthcare costs. One of the biggest challenges, of course, that our families are facing, our businesses, our local government, our state government is high and rising healthcare costs. So we want to do everything we can to continue to provide good quality healthcare for everyone, but also bring down the costs. And I believe one of the most effective ways we can do that is by attacking, these high rates of preventable chronic diseases. We're talking about, type 2 diabetes. We're talking about obesity, heart disease, a number of kinds of cancer, and there's strategies we can do through public health to focus on prevention and wellness to help bring down those rates. And so those are things I've been working on for some time, and we're going to continue to really stay focused on those efforts as much as possible.
Are there any areas that are more important than others in this, like prioritizing
Yeah,
it?
so one, there's a variety of areas. One in particular that I've been working on, and I have some legislation that I've filed, and we're going to be working on it in the Public Health Committee, is called an Act to Prevent, to protect young people from from tobacco and from nicotine addiction. And one of the things that many people are surprised to learn, because rates of cigarette smoking have come down, which is a good thing, but tobacco is still the leading preventable cause of illness and premature death in Massachusetts, and it costs our state billions of dollars each year in healthcare costs directly tied to diseases from tobacco. So anything we can do to continue to bring down those rates of tobacco use would be good for people's health and good for our budget as well. And 95% of people who become addicted to tobacco start before the age of 21. So it's basically it's a pediatric disease, if you will. It's teenagers. So this legislation would raise the legal age from 18 to 21 for purchasing tobacco products, and it would also include vaping, which is e-cigarettes, which we've seen really exploding in our schools. It would include e-cigarettes also within our definition of tobacco. And so, for example, where you can't smoke, like restaurants or schools or workplaces, you wouldn't be able to vape either. So that would make it consistent across the state. And we have a lot of evidence that policies like this help to prevent young people from starting this in the first place. And that would lead to better health and lower healthcare costs.
The vaping is a big problem with the young people, and it seems to me that they don't feel as though it's as serious as smoking.
Right.
I mean, that's the...
Yeah,
That's
you're
the way
absolutely right. I have two teen daughters,
Yeah.
and my daughter was telling me how it's just exploded in the high schools, and and you're right. Teenagers think that it's safe and it's cool and harmless, and it's not. E-cigarettes include nicotine just like regular cigarettes. There's lots of different chemicals that are in the liquids, some of which we don't even know what's there because they're largely unregulated right now. The FDA is just starting to move on regulating them, and anything that gets young people basically starting to use nicotine, which is a highly addictive drug, is a bad thing. So that's why we really have to act, I think, with urgency. And Wakefield itself has done some really good things through the local Board of Health, to try to address this. But then, teens can just go across the right over to Woburn, for example, where they allow sales of these products everywhere, and there's the legal age is only 18, so it's very easy for them to still get, and also unfortunately online as well, they get some of these products. So that's why I think we really need to take action.
Okay. Now, in addition to serving as chair of the Public Health Committee, you're also the chair of Labor and Workforce Development in this session. What does that cover, and how will that impact our communities?
So that I'm excited about. Thank you very much. I'm excited. That's a new assignment for me.
Yes.
So
you don't have enough on your plate,
I'm doing double duty this session. What happened to the senator who used to chair the Labor and Workforce Development Committee? He basically retired from the legislature.
Okay.
And he had chaired the committee for 8 years, so he was really an expert on issues of labor and workforce development. So I'm drinking from a fire hose right now, trying to come up to speed on all the different issues. So this committee deals with issues like our job training programs, other kinds of workforce development, spanning all the way from high schools through mid-career changes that people are going through in their careers. It also includes issues like the minimum wage, collective bargaining, and various union-related issues. Our laws around hours and wages and overtime, paid family and medical leave, non-compete agreements are all kind of in the jurisdiction of this committee. So we've got a lot on our plate, and right now I'm just working to come up to speed, and we're setting some priorities for the committee. And the other thing I wanted to mention is that my co-chair on the committee, who's on the House side, is Representative Paul Broder,
Oh, my.
who
Yeah.
also represents Wakefield. So we know each other very well, and it's fun to work together on this, chairing this committee.
Yeah, it really makes it a lot easier when you can communicate with somebody that you're familiar with, and you can get things done a little bit faster.
That's true.
Get through the process a little bit quicker.
That's right. Although we do see a lot of each other now these days.
I know I've been to a few of your events there that you have to go to, and there you both are, and so it's kind of a nice mix there for
We do.
you.
We see each other right here in Wakefield and in Melrose, and then also at the State House. But I'm really excited. I think we're going to work well on a number of these issues, including what's going to happen with non-compete agreements. I know that's an area I've worked on, because I think that these are agreements that workers are often forced to sign when they join a company that basically can prevent them from leaving to go to work for another company that may be in the same sector. And I think they're unfair to workers, and also they impede innovation in our economy. You know, California, for example, does not allow these, and that's one of the reasons that they have such a successful innovation economy. So we're hopeful we can do something to scale those back this session, and that issue is going to be worked on in the committee. We're also going to be looking at our minimum wage in Massachusetts, and whether that whether that should increase. We're also looking at the issue of family and medical leave. Right now, that's people can take leave if they need to for a birth of a child or for illness in the family, but for many people that's unpaid. And the problem is, that this, many workers who cannot afford to go without a paycheck, and so it's just not available to them. There are a few other states that have put in place paid family and medical leave insurance programs. So we're looking at whether that's something we could do in Massachusetts as well.
Yeah, that's very true. I mean, if somebody has to spend 12 weeks away from their job for whatever reason, it's pretty difficult to make up that loss.
Right.
So if this passes, it would they would get paid for those 12 weeks?
Essentially, that's right. Essentially, it would create like an insurance program.
Okay.
Sort of the way we do for, say, workers' compensation. So everyone who's working would essentially pay in a little bit. And the question is, obviously, which is controversial, is how much would employers have to pay and how much would employees, sort of what would the split be? And then essentially, if you then have a legitimate reason to take leave because you've had birth of a child, you have a serious illness, or you have to take care of a family member with an illness, there would be certain reasons, then you'd be able to take leave, and a certain portion of that, up to a certain number of weeks, would be paid. Probably not 100% of your salary, but at a percentage of it. And the idea is to basically enable people to take the leave that they may very well need. So it would help a lot of working families who are struggling. It's complicated though in terms of exactly how you would structure it, and how much businesses would have to pay and how much workers would have to pay, and there are concerns from some of our small businesses about how they would afford it. So that's why we have to really talk to all the stakeholders and work on this. But it is a priority for Representative Broder and I and the committee to work with all the different groups to see what we can do here in Massachusetts.
Yeah, it's. Do you think it's something that will get through all the committees? How long do you think something like that?
It's a tough question, I'm sure. It is. Ordinarily, there'd be a lot of work to do, and it's difficult to pass any bill, and this one, of course, is fairly controversial. But what's interesting in this case is there's a high likelihood that if the legislature and Governor Baker are unable to agree on creating a paid family and medical leave program, it may appear on the ballot next year. Next November when we have our election. There's a coalition called the Raise Up Coalition, and they have said that if this issue is not resolved by the legislature, and then they are committed to putting this on the ballot. And if you remember a few years ago when we had paid sick time, which was on the ballot, and Massachusetts voters overwhelmingly supported that, the same group that pushed that forward and put it on the ballot and educated voters is the same group that is working on paid family and medical leave as well. So there's an incentive, I think, for all the different parties to work together, see if we can, reach a consensus in the legislature. Otherwise, this could be on the ballot next year, and then voters will get to decide.
Okay. It's another way of going about
Right.
it.
By the way, the same's true for the minimum wage.
Yeah. Oh, okay.
The same organization have said that their two priorities are to raise the minimum wage. They want to raise it to $15 an hour, not immediately, but over time, and to create a paid family and medical leave program. So those two issues are very high priorities for the legislature because, again, we want to try to see if we can work it out and work with the business community and all the different stakeholders. Otherwise, it could well be on the ballot.
Well, that is interesting. Do you have any additional legislative priorities this year?
So those are certainly among them. Another big one for me, which actually we do have some progress on it in the budget that we're working on right now that I talked about earlier, is to update the school funding formula for the state. As we've talked about in past shows, the way we fund our public schools is outdated, and that formula dates all the way back to 1993, and it doesn't adequately reflect things like the rising healthcare costs and the number of students who have special needs and new technology that our schools need. So as a result, our schools are really not getting adequate funding from our state to support all of their needs. And we see the challenges that schools here in Wakefield and in other communities are struggling with all the time. So there was a Foundation Budget Review Commission that I filed legislation a few years ago to create, and we are now trying to get the recommendations of that commission implemented. And the Senate budget does actually start to implement that, and that would lead to increased funding for our public schools. So we're trying to move that process forward, and that has been and will continue to be a high priority for me, because it really impacts our ability of our communities to maintain really strong schools.
Well, it certainly is very important, and there's a question about it. It's a tough road, too, because like with everything else, you have so much on your plate that how much time can you devote to anything? And it just seems like you must have a great staff. That's all I'm saying. My goodness.
Well, I appreciate that, and I am very lucky. I do have a terrific staff that works with me here in the district and the state house. But the biggest challenge in terms of updating the school funding formula is really we're talking about potentially a lot more money that the state would have to be investing in our schools, and the state budget is very tight. So that's the challenge, is we've got to find a way to come up with that money to invest in our schools.
I'm going to change the subject a little bit. Keeping a close eye on Washington and making sure that state government picks up slack remains responsive if feds under Trump drop the ball.
Yeah, so there's a lot. I think you're sort of referring to everything, of course, that's happening in Washington right now, and we are watching at the state level. We're watching very carefully because we are very concerned on a number of different things that could impact our states, both our state finances as well as our impact our residents and our businesses. One in particular is the healthcare bill that is being discussed in Washington right now, Republicans in Congress, because the problem is that if that bill were to pass, it proposes very, very significant reductions in Medicaid spending. And the Medicaid is basically our major health insurance program for people in Massachusetts, many of whom are elderly, many of whom have disabilities or are poor. Many of our children are covered by that. It's known as Mass Health. And the way we pay for Mass Health is 50% roughly comes from the federal government, 50% comes from the state government, state budget.
Okay.
So it's shared. So if the federal government, reduces its commitment to Medicaid, which is what's proposed in this in the Republican health care bill that's being discussed right now, then what does the state do? We don't, how would we make up potentially billions of dollars? We don't have that money. We can't just take it from our schools or from our transportation system. So that would probably lead to very significant cuts in the number of people that can have access to Medicaid, to Mass Health. And I'm hearing from many constituents in our communities who are very, very worried, what would happen to their access to health care. And remember, Mass Health, many people don't know this, it also covers for many people in nursing homes. That is essentially what covers those costs for long-term care. And many people with disabilities, whether that's very, very significant physical or intellectual disabilities, a lot of their health and other costs are also paid for by Mass Health, and there's nowhere else they would have to turn. So this is a really, really serious issue. And so we really appreciate that, Governor Baker and, Congressman Moulton and Senator Markey and Warren and others are really trying to make the case down in Washington that, that would be, devastating, if Medicaid was to have the kind of cuts that they're talking about. That's not the way to improve health care, in Massachusetts and the rest of the country.
Well, it is confusing. There's no question about it. I listen to it, and sometimes I don't know where it's going or what's going to happen because people can't get together on certain items.
Yeah.
And the only thing I can say is that they put pressure on themselves to come up with something, but then they can't seem to finish it off. That's just my take on it.
I hear you. I wish that, and I actually think this is something we do really well in Massachusetts. I wish they would work together. Because look, no one's saying that the healthcare system we have either in Massachusetts or around the country is perfect. We need to control costs better. We need to bring down prices of drugs. We need to improve prevention. We talked about that before. We need to improve access to healthier food and all kinds of things. But you can't do that through just Democrats on their own, or Republicans on their own. They have to work together. And that's how we've done it in Massachusetts. When we passed our universal health care law, that was a Republican governor, Mitt Romney, and a Democratic legislature. And the things we've done since then have always been basically bipartisan. The state Senate, for example, we have 40 state senators. Most are Democrats, but we have, I believe, 6 Republicans. Most of the legislation that we take on, and certainly what we do in healthcare, is bipartisan.
Yeah.
We don't. It's rare that we're going to try to push something through that is only going to be one party supported. So we will work together, and that's what needs to happen more in Washington. They just need to say, okay, we may not always like each other, we may not agree, but we've got to work together. And otherwise, you just are not going to get solutions.
Nothing's going to happen. And on a level outside of Washington, something that a lot of people are on, in other words, and they listen to this and they watch the news and everything. And when they get through, they just said, well, what's wrong? Why can't they work together? And
and it didn't used to be that way, right? They used to be a lot more cooperation.
Somehow things got done. And then they're always bringing things to a point where they have to make a decision, because if they don't, things are going to shut down. And then now they make a decision, but it's a temporary decision. Then they have to deal with it down the road.
Yeah. Well, it is really concerning, and I just hope that what we're doing, the way we run our local towns, is a good model, and the way we try to run our state in a bipartisan fashion, and again try to not have everything be a crisis all the time, is the best. At least we can do our part, and I hope that can be a model for how we would hopefully do things in Washington as well.
Well, I think we're just about out of time here, and we've touched upon some of our feelings of the way things are going, but at least in Massachusetts, I see a lot of progress, and I really believe that a lot of things will be getting in. I'm happy that you're on board here again. You've been around now. For how long have you been?
I've been privileged to be the state senator for Wakefield and the rest of the surrounding communities since 2014.
Wow.
So I guess, what am I now? I'm not quite a freshman anymore, but not a
junior, maybe.
A veteran yet.
I don't know.
Yeah,
but,
maybe a sophomore or junior.
You're doing a great job, and I really enjoy having you come in to talk about the shows, and you always are a wealth of information. And I learn an awful lot whenever we sit down
Well,
like this.
thank you, Tom. It's my pleasure, and
Right then.
always want to let the viewers know. You know, I want to be accessible to folks, and so I always welcome, you know, anyone who wants to, you know, come and meet with me, call me, email me, you know,
Right.
contact on social media. Any questions that anyone has, or any, you know, concerns about what's happening, or certainly any feedback as well. I really appreciate that.
Very good. Well, okay, I look forward to our next meeting and discussing whatever else happens between now and then. Okay.
Great. Thank you.
Thank you very much. Okay.